Young stroke. Stroke is often considered as an older person's disease, and only 10% of stroke patients are younger than 50 years. But recent reports show an apparent increasing trend in ischemic stroke among young adults, a figure that is particularly concerning, when compared to the overall decrease in stroke incidence and mortality. Although certain rare risk factors have been suggested as possible causes, reports show that traditional risk factors for stroke are also high in this population. The lifetime impact of stroke on young adults carries substantial costs to the individual's family and to society. A recently completed study looking at mortality from different kinds of stroke over a 20-year period shows that mortality from ischemic stroke has dropped by more than 50% in older adults, but it actually rose a little in young adults. There is a big difference between what is happening in older adults and what is happening with mortality from ischemic stroke in younger adults. The hemorrhagic stroke in young adults declined, while ischemic stroke increased by 11%. A 2014 Finnish study of 970 young adult stroke patients showed that the observed mortality for young adult stroke patients was sevenfold higher than the expected mortality in the general population. Until recently, stroke in young adults had been thought to be associated with rare risk factors, such as arterial dissection, reversible cerebral vasoconstriction syndrome, inflammatory arteritis, cardiomyopathy, and several hypercoagulable factors. There is a misunderstanding among physicians that hypercoagulable conditions such as prothrombin mutation and factor V Leiden cause early onset strokes. A study over 25 years, on a large number of early onset strokes showed, arterial ischemic stroke that was due to a hypercoagulable condition, can be counted on the fingers of one hand. A publication in Nature Reviews Neurology found that although the role of rare risk factors in the pathophysiology of young stroke seems overestimated, the role of traditional vascular risk factors may have been underestimated. The rising incidence of stroke in young adults coincides with an increasing prevalence of traditional vascular risk factors in this age group, although they note that causality has yet to be proven. Researchers noted that primary risk factors associated with the highest 5-year risk of recurrent stroke included the traditional vascular risk factors, including being older than 40, having a history of transient ischemic attack or type 1 diabetes, and taking antihypertensive medication. In addition, the studies showed that mortality risk also increased with the number of traditional cardiovascular risk factors. As for genetic risk factors, the genetics of early onset stroke meta-analysis failed to show statistical significance for an association of the prothrombin G2021A mutation with ischemic stroke in young adults of European ancestry, and there was no association with cryptogenic stroke or those with cardiovascular risk factors. The long-term prognosis for early onset stroke appears to be somewhat more severe than previously thought. Although there is a lot of anecdotal evidence that young adults do better after a stroke than older stroke patients, compared with the general population of the same age, young adult stroke patients experience higher death rate, higher risk of cardiovascular events, and significant limitations in quality of life. Many patients continued to have poor functional outcomes even 9 years after the stroke. Functional outcomes may not be enough to measure the full impact of stroke in young adults. What is missed is, can they live a normal life? Can they keep their jobs, raise their kids? Can they support their families? Those are significant to young adults in the situations they are in, and stroke absolutely affects that over their lifetime. In terms of addressing the trend and taking stroke prevention measures aimed at young adults, the key may lie in changing the mindset that stroke is a disease of older people. One of the big questions that comes up is, are we missing atherosclerotic risk factors in young adults? We need to recognize that stroke is not just a disease of older adults. It happens across the entire age spectrum, and it is really important to be aware of that so we can think about prevention, recognize stroke when it happens, and treat it urgently to minimize future disability. The take-home message is that traditional risk factors should be managed aggressively, and reinforce the health efforts, to reduce the obesity epidemic, to prevent the future increasing risk of vascular disease in younger adults. Every young adult stroke patient should have a toxicology screen because no one can tell who is abusing drugs from the patient's demographic profile. Stephen Kittner, professor of neurology at University of Maryland, said, "It is very prevalent, and if you don't do a toxicology screen on admission, you may miss an important modifiable factor for the cause of the stroke." Thank you.